Welcome back. Today my video is going to be all about my appointment with the maternal fetal medicine doctor specialist person that went so well. So I'm really excited to talk about this one. Okay, so let's start where I left off last time. My OBGYN said that the MFM would call me to schedule my appointment. So I waited a week. She said if they didn't contact me within a week that I could call back. And a week passed and they still hadn't called me. So I called them and was able to get through and talk to the secretary for the MFM. The MFM is only at the hospital here once a week. So that's kind of was tricky. I was a little bit nervous that maybe we wouldn't be able to get in for like a long time. But luckily, they had an appointment for the next week. So I was really excited about that. And so I needed to wait another week, but I made it through to the next week, and I was really, really, really excited to go to my appointment. We went, and it was just like the doctor's office was so just, I don't know, it was just different than my regular OBGYN, but like it was just also at the hospital. But their office is like smaller because they don't have as many patients, I think, and so it just was more comfortable feeling. I didn't know which doctor I was going to be seeing, but they took me right back, and it was so nice because I didn't even have to like see a nurse or anything like that. The doctor just walked right in, and we were just in his office, so we just pretty much chatted about everything. I kind of gave him information about my history, like he had read my chart and everything, which was really nice to feel like he knew me and my situation before I even had to tell him anything. He started off the appointment by saying, in your situation right now where you have no kids and you've had 3 miscarriages in a row, the chances of you getting pregnant and having a healthy pregnancy and getting like a healthy baby out of it is 85%, which was like really good to hear because I had been looking at all these different percentages online, but like it just varies so much. So it was really good to hear it from the doctor that like without any treatment or any testing, nothing, that we still had like an 85% chance of getting pregnant and having a healthy baby right now. So that was so comforting. I hadn't had the blood work that my OBGYN had ordered. I hadn't had that done yet. Because I didn't really understand why I was going, like why she wanted me to do that. And so it was nice because I was able to talk with the doctor and he explained everything, why she had ordered different tests and what information they could get from those tests. And he said pretty much those tests are like the regular recurrent pregnancy loss workup type thing. So like he was also supportive of me getting those blood tests done. We also talked a lot about the likelihood, I guess, of whether or not the results would come back with any information, which I had read a lot about. Only 50% of the time will they actually find a cause of the pregnancy loss. And so he pretty much supported that same information. I guess he said that most likely all of the blood work is going to come back negative, like normal, I guess. And so that's kind of unfortunate, but he still says it's good to do. I just felt really comfortable talking to him and telling him how I felt about different things. And he was very good at just giving me all of the information, pros and cons, and then just really said, like, it's your decision. And he said, if you're one of those people that if you got pregnant and had another miscarriage and you'd be like, dang it, I wish I would have done the testing, then you should probably do the testing. And I was like, that's me, so I'm gonna do the testing. Like I mentioned in my last video, my OBGYN had also referred me to a genetic counselor. So when they had called to schedule my appointment with the MFM, they said that I could just get in to see the genetic counselor right after my appointment, if that's what the doctor also recommended, because I wanted to see what his opinion was. So I asked him about that, and he said that he thinks it would be a good thing to do just to rule out everything that it could possibly be. And so we were able to meet with the genetic counselor also. Because of coronavirus, the genetic counselor wasn't actually in the office, but they had a computer and everything set up in the doctor's office, and so they just had the genetic counselor call in, and she was able to video call with me and Matt, and she was awesome. So good at explaining everything in a way that was understandable to us. She explained how genes can affect pregnancy, and she talked about translocation, which is when a piece of one chromosome gets hooked onto another chromosome. So you either have too little or too much of a certain chromosome, and those are things that can affect miscarriage and I guess like the health of the baby. She also just talked with us about our family history, asked if there was a history of miscarriage in our families, if we had anyone in our families who had any chromosomal abnormalities, I guess. I have a sister who has Down syndrome, and I also have people in my family who have had miscarriages, and so she was more concerned with my genetic background than she was with Matt's. So she really just gave us, once again, all of the information and said that it was our choice whether or not we wanted to pursue genetic testing. She told us the likelihood of them being able to find something, or of the miscarriages being linked to something genetic. And I cannot remember those numbers, so whoops. She said that we could either both pursue genetic testing, or we could start with one of us and then do the other one if it doesn't come back with any results, I guess, that give us any more information. She recommended that if we decided to do that, to start with me, just because she was more concerned about my genetic background. So we kind of were like, okay, yeah, I think that's what we want to do. She said that she has to get pre-authorization through the insurance before we can get the blood drawn to start the genetic testing. The pre-authorization through the insurance, she said, can take anywhere from like a day to 3 weeks. So we're hoping for shorter, obviously, because the waiting is really hard. It just depends on the insurance. So we'll just be waiting for that. But after that gets back, then we can go in, get the blood drawn, and then it will take anywhere from a week to a month to get the results back from the genetic testing. For the genetic testing, they'll just draw our blood, and then they'll do a karyotype, which maybe that word sounds familiar to you, but I remembered it just from like high school biology. But that's when they take they pretty much separate out all of your chromosomes and pair them together, and then look at them to make sure that there's nothing abnormal with your chromosomes. Like I mentioned, a translocation could affect a baby, and so they look at that all of your chromosomes are there and they're in the right amounts, I guess, too, that you have the right amount of every single one. The results from the karyotype do come back showing something. That the options going forward are pretty different, just because, I mean, you can't change your genes with an antibiotic, so there's that. But she said something that is a potential is doing IVF and having, like, looking at the embryo before implanting it to make sure that it's genetically normal, which that kind of freaked me out a little bit, just because that's expensive and time consuming and everything scary. It just seems very overwhelming right now, but she just was like, I just wanted to let you know it's an option kind of thing. So it was good of her to give us that information, and I'm grateful for that. So we just have to wait for those results. But that appointment went so well also, and the genetic counselor was great. She gave me her personal phone number and her email, and it was just so nice to feel like she cared about us. Something else that happened at this appointment that was just like so heartwarming to me was that after talking with the genetic counselor, the MFM was in a conference call, and he told the secretary, if they have any questions for me, just come and get me out of this conference call and I will end the whole thing just so that I can talk to them, which was just like totally something that I needed, because I just had been feeling like no one really cared, and it was just nice to feel like he honestly cared about us and he was willing to answer any question. So he did. He came back in, he talked to us for probably like another 10 or 15 minutes, answered some last questions that we had. Some of those questions were like, what if all the testing comes back negative and there's nothing? Like, what are the options going forward? And he mentioned that maybe we could do something called heparin, which is an injectable antibiotic, I guess, that they use when people have blood clotting disorders. And so he talked about that. He said that he wouldn't be opposed to prescribing that to me. And so that was good to know that there are some options, even if the results come back with nothing. Obviously, we hope that, well, I don't know what we hope. I don't know if it would be better for there to be something wrong or not, but it would be really nice if there was something that was able to be helped, that we could just, get on an antibiotic or something, and hopefully it will be better next time, but who knows. So I don't know if I want there to be something wrong or not. But the appointment went so well, and I was just really, really happy. And I was like, told the doctor, I was like, thank you so much for listening to us. Like, we're so grateful, because genuinely that was what I needed so badly, was just to feel like someone cared and was going to try and help us, which was really, really comforting. So now we're just playing the waiting game for who knows how long, which is really difficult, just knowing that we don't really know how long it could be. So we're just trying to be patient, which is not my strong suit, but we're trying our best. So that's kind of where we're at with that. As always, feel free to share this with anyone who you know that's maybe going through a similar situation. And if you're going through a similar situation, just know that you're not alone. Thanks for watching. Have a great day.